Hi all of you, a very good evening to you all and welcome to the next review session on pharmacology. As you all know, we are reviewing the antibiotics, the most important areas for antibiotics, okay, based on the most recent questions. So in the previous session, we discussed the mechanism of actions and related things, which I would say is the most important. But yes, today we are going to discuss some very specific agents, again the key points of them. Okay, and the first area to be discussed will be on the beta-lactam antibiotics, where I'll be discussing on the mechanism of resistance, mechanism of development of resistance towards beta-lactam antibiotics one, and some specific drugs. Now, yes, this has been questions. Now, three methodologies of development of resistance has been noted against the beta-lactam, of which one is called alteration of permeability into the cell. Now, the alteration of permeability of the penicillins or beta-lactam antibiotics into the cell is being happening, and which is causing the resistance. And yeah, the most common organism responsible or creating this type of resistance is gram-negative organisms. Okay, then you come to the most common, most important, that is beta-lactamase production. You know that this is a beta-lactam ring, this antibiotic. So if the bacteria produces this beta-lactamase or penicillinase, this will break down this particular beta-lactam ring. Okay, breakdown of the beta-lactam ring of the antibiotic. Now here the organism which is causing is the gram-positive as well as negative can produce this beta-lactamase. Finally, altered penicillin binding protein, the transpeptidase we discussed in the previous session. So it's also known as penicillin binding protein. Now this is majorly done by a very important organism which is called MRSA. Okay, methicillin resistant staph aureus. Now you know that the staph aureus is gram-positive. Microbiology. So this is three mechanisms. One is the permeability being altered. Second is the beta-lactamase production by the bacteria in itself. Third is the binding protein is being altered. Okay, so these are the mechanism of resistance. Now let's come to the next part, which is definitely some very specific drugs. Okay, of which I'm going to discuss about penicillin G. Okay, and the modifications which has led beyond penicillin G or due to disadvantages of penicillin G, and then I'll be discussing two more, that is monobactams and carbapenems. Only the key areas, don't worry, there is no excessive discussion here. Now penicillin G, lots of things has to be learned here and modifications. Now penicillin G, please note its other name is benzyl penicillin, and one more thing just to add here, it's the only naturally occurring penicillin. Okay, all others are semi-synthetic. Now there is no being question there, but yes, just good to know. Now penicillin G or benzyl penicillin is a drug of choice of GST. Okay, drug of choice in GST. So what is it? Gas gangrene. Okay, it's very important to note that the G here is gas gangrene. We are going to soon come to gonorrhea, which is another antibiotic. But please note penicillin G is gas gangrene. One, then yes, very familiar syphilis, and the third is tetanus and not typhoid. Okay, don't confuse because I'm going to come to that. So it's gas gangrene, syphilis and tetanus. The question being asked is the syphilis. That is, the question is the drug of choice in syphilis is what? It's benzyl penicillin. Okay, now basically now there are some problems. Though it's a very key drug, there are some problems. It's not effective orally. You give it orally, it will not be effective because they break down by the acids in the stomach. You know, stomach has got lots of acids, especially the hydrochloric acid. So it destroys the penicillin G. Okay, so now you have to modify, you have to come with some semi-synthetic agent which can be given orally, and we have been giving orally. Okay, that is the acid-resistant penicillins. Okay, acid-resistant penicillins. So which are they? To remember that, there is a short form called vodka. Okay, vodka. So some very naughty short forms today. One is vodka. That is V, penicillin V. Now this has been a question. Which of the following is an acid-resistant penicillin? Answer is penicillin V. Don't confuse. It's not penicillin G. Penicillin G is acid sensitive or destroyed by the acid. Now that's the only question in this area, but good to know other agents. Oxacillin, dicloxacillin, so related, oxa, dicloxa. Then you have got cloxacillin, so oxa, dicloxa, cloxa, and finally the very familiar amoxicillin, ampicillin. That's why we are giving it orally, isn't it? It's a very important agent. We are giving it orally, amoxicillin and ampicillin. So acid resistant vodka. Just remember it as the vodka is resistant to acid. The raw vodka, which is one of the very famous alcohols used in Russia, vodka. Now another problem with penicillin G is it's resistant, or I would say, sorry, it's narrow spectrum. Okay, it acts against very specific agents, like we said, GST. Okay, so you have to have a broad spectrum or extended spectrum penicillin. The spelling is wrong there, but just note extended spectrum penicillin. So for that, there is again a division, which is that is aminopenicillin. Again, familiar one. Carboxypenicillin, uridopenicillin. One point to note. So let's see one by one. There's a short form AA, or you can call it as ACT map. Okay, AACT map. Now AA very familiar. Amino ampicillin amoxicillin. That's AM. Okay, these are aminopenicillins. Okay, ACT map. Now when you come to CT map, so that's aminopenicillin. CT map is carbenicillin. Again a question asked, which of the following is an extended spectrum penicillin? Also, please note the CT map. Please note CT map, the short form, is basically these are all anti-pseudomonal penicillins. You know, Pseudomonas aeruginosa, one of the very common agent causing nosocomial infections. So most nosocomial means from hospital. So any agent which can easily survive in hospital, that is hospital antiseptics, it's very problematic. So there should be some agents which is specifically acting against the Pseudomonas aeruginosa. So the CT map is very effective in that sense. Okay, so CT maps carbenicillin, ticarcillin. You have seen this. Okay, carbenicillin has been a question. Carbenicillin, ticarcillin. Okay, and map meslocillin. Okay, meslocillin, azlocillin. Okay, piperacillin. So piperacillin has been a question. Carbenicillin has been a question. Rest there has not been questions, but yes, good to know. Okay. And CT map, just remember, ACT CT map. AA, there is no pseudomonal activity, but yes, the CT map is very important, pseudomonal penicillins. Okay, so far we studied acid resistant penicillins and extended spectrum, both due to disadvantages. Now, few more key points to note on penicillin G is that normally all the penicillins doesn't enter the blood-brain barrier. Okay, it doesn't enter the blood-brain barrier normally. Okay, but now when there is a meningeal inflammation, so what is the meningeal inflammation known as? Infection with inflammation of meninges is called meningitis. So when there is a meningeal inflammation, these drugs, including penicillin G, can enter into the meninges, or I would say blood-brain barrier. Okay, so as a result, it can be used to treat meningitis. So it's a question, which of the following is true about penicillin G? It can be used to treat meningitis, yes. Okay, it's acid resistant? No, it's acid sensitive. It's narrow spectrum and it's used to treat meningitis. Now, one more thing, another question asked, does it enter the prostatic secretions or intraocular fluid? No, it does not enter into the prostate or prostatic secretions or in the intraocular fluid. So eye infections cannot be treated. Okay, so that's another question which was a true statement. Okay, so please note this was the question asked on the penicillin G. Okay, and also note GST. And we said the vodka, which is acid resistant. Then we have got a broad spectrum, which is AACT map. Then CT map is pseudomonal, this blood-brain barrier, intraocular, and the prostatic fluid. Now basically another thing, it shows resistance. The penicillin G shows resistance to penicillin. Like we said, one of the mechanism, which is penicillinase production by the bacteria, and this penicillin G becomes ineffective. Now we have come with another modification, which is not penicillinase resistant penicillin, penicillinase resistant to penicillin. So it is again a naughty short form, which is called a condom. Okay, you have got cloxacillin, again some of the ones in vodka. Cloxacillin, there is vodka C is there, oxacillin, and so, okay, one thing I just missed out here was, okay, yeah, ampicillin. We studied aminopenicillin, ampicillin. A very important question asked here for ampicillin is, which is the most common adverse effect of ampicillin? It's diarrhea. Okay, the most common adverse effect of ampicillin is diarrhea. Okay, please note that. So that's a point I missed out there. So please just note it there. Now, cloxacillin, oxacillin, nafcillin, okay, dicloxacillin, same thing, vodka, methicillin. So this methicillin is very, very important. I told you MRSA, methicillin resistant staph aureus. Now, this basically, all these agents were penicillin resistant. Then there came one organism which was Staph aureus, which started producing methicillin resistance. So even your methicillin was not effective. So then we came up with the drug which is sensitive for even the MRSA. Okay. So okay, one more thing. Like we studied, ampicillin causes the diarrhea. Methicillin, there has been asked a question. Most common adverse effect is interstitial nephritis. The interstitium of your nephron gets inflamed. That's called interstitial nephritis. So most common side effect of methicillin is interstitial nephritis. Now, as I've told you, there is MRSA. So you have to use some drugs for MRSA, methicillin resistant Staph aureus. So what are they? Okay. Now there are, in this category, there are some drug of choice against MRSA. You've got other drugs which can be used and some very recently approved drugs. Okay. So definitely always use drug of choice. Whenever there is methicillin, you feel like there is, and see, currently most of the organisms are methicillin resistant. You don't use methicillin. We use a drug of choice, which is mostly we love. How you remember is drug of choice, we love. Other drugs, CD, conservative dentistry or complete denture, whatever, in college. Okay. So I think good to note it down, like the complete denture, which we don't love, so we love. Okay, in college. Okay, we love in college CD. Okay, and one very recently approved. I'll come to that. So we love. V is not penicillin V. It's vancomycin. So vodka was penicillin V. Here it's vancomycin. We studied very recently vancomycin. Okay, which is again a beta-lactam antibiotic. Van, bus, yes. Then L, linezolid. We studied protein synthesis inhibitor, linezolid. Okay. Then C, it's not your cloxacillin and all, because all these are again related to methicillin. So it's beyond that. That's one thing. So C in not in the one in quantum or vodka, not cloxacillin. What I mean here, it's clindamycin. So what is clindamycin? We studied very, very recently that it's a lincosamide. Okay, lincosamide, yes. Then D for doxycycline minocycline. It's a part of tetracycline. So please note, MRSA, okay, basically tetracycline is not effective, but the modification which is doxycycline minocycline is. Now N is imipenems. We're going to come to that, which is actually a broad, I would say it's a beta-lactam, imipenems. And C for college, which is ciprofloxacin. Okay, ciprofloxacin is a fluoroquinolone. So always confusion, cephalosporin. So cephalosporin is a beta-lactam. Ciprofloxacin is a fluoroquinolone. Okay, fluoroquinolone. Okay, we have studied it, the mechanisms, everything is studied. So that's about we love. Now this is a question again, which of the following drug is effective against MRSA? The question asked was on one was option in this, all of the following except. So one option was clindamycin was there. And yes, I think, and the other options, linezolid and vancomycin was there, I think. Okay, so anything can be asked here. So remember the short form, we love CD in college. Okay, vancomycin, linezolid. This is a drug of choice. They always ask this. Okay, vancomycin, linezolid. Very, very important. The most important is vancomycin. Okay. Then CD in college is clindamycin, doxycycline, minocycline, imipenems, and ciprofloxacin. Now, very recently approved, which we are going to come to, is 5th generation cephalosporin. So there are different generations of cephalosporin. We are going to study that, and I'm going to give the names also. But for the time being, just note 5th generation, which is against MRSA. Okay, so just quickly review. Stop the lecture, review your lecture notes. Let's go to the next one. Okay. Otherwise, it will just become like a sambar. It will just become problematic. Now, monobactam, definitely another beta-lactam antibiotic. And a very, very, very important drug in monobactam is aztreonam. A question asked in a very recent exam, I think 21-22 or 22-23. Aztreonam. Okay, very important drug. Now, what is the importance of this drug is, okay, I'll just take it close. what is the importance of this drug is it's only beta-lactam antibiotic. Please note, only beta-lactam antibiotic which is used against when there is a penicillin allergy or cephalosporin allergy. Please note, penicillin, cephalosporin always cross react because these are beta-lactam. Now, there is a beta-lactam option available for you if you want to use. Okay, that is the key, which is aztreonam. What is the other drugs used? Erythromycin, clindamycin, all this can be used. But there is one beta-lactam. So all these erythromycin and all thromycins, which is what? Macrolide. So these are not beta-lactam. The only beta-lactam you can use is aztreonam. Please note, aztreonam. Okay, the name is specific. Okay, name now. Okay, then finally that was about the monobactam. Now you have got carbapenems. Again, a question asked in a very recent exam. Example of carbapenems are penems only, meropenem and imipenem. So basically penems. Meropenem was asked. Okay, the question was which of the following can be used in case of, or which of the following beta-lactam antibiotics can be used for Klebsiella pneumonia? And the option, one of the options was meropenems. Okay, there's some understanding here. You have to understand why Klebsiella pneumonia is specific. Okay, spelling of pneumonia is wrong. Pneumonia. Okay, now yes, what is the key? Why is it important? Now these are the, again, only factor comes. These are the only beta-lactam antibiotics. Please note, these are the only beta-lactam antibiotics which can be reliably efficacious against ESBL organism. We studied penicillinase producing organism. Okay, now there is a more dangerous organism which is extended spectrum. Okay, organism. So what is basically ESBL? Let's see that. Extended spectrum beta-lactam is. So we saw beta-lactam is producing, which was in itself a dangerous thing. Now we come across extended spectrum. So the only beta-lactam antibiotics which is effective against this ESBL producing organism. What are ESBL producing organisms? Basically the Klebsiella. Okay, that is ESBL producing organisms which are exclusively gram-negative. Remember microbiology, gram-negative organisms. Two we studied is Klebsiella and E. coli. Of which Klebsiella. So that's why this, hope you got the connection now. Meropenems and Klebsiella pneumonia. Why? Because these are the ESBL producing organisms against which the only beta-lactam antibiotic which is effective is meropenems or imipenems. But in the option it was meropenems. Okay. So that is about your beta-lactamase. Okay. Three very important drugs. That is penicillin G. Then you came to monobactam and carbapenems. Now, another beta-lactam antibiotic we're going to see is cephalosporin. So please note, this is also a beta-lactam antibiotic, means to say that this also has beta-lactam structure. One, it cross-reacts with penicillin. Okay, that's why we are using aztreonam even for that, if at all. Now, yes, cephalosporins, please note a few very important things to note, and which, yes, it's an amazing thing to learn the generations. We're going to study some tricks today to learn them. Okay,